All right, well, I'm just going to quickly cover some of the data over the next few minutes. The slides that I'm going to show you are graphs that come from our modeling team's report, which should be published sometime today on the Institute for Disease Modeling website. So as Dr. Weisman just mentioned, our COVID-19 cases continue to surge. The graphs on the top represent cases, tests, and hospital admissions in Eastern Washington, and the graphs on the bottom represent data from Western Washington. And you can see the graphs on the left side show very steep increases in cases, which we are seeing both in Eastern Washington and Western Washington. The middle graph shows a slight increase a slow increase in testing, but not nearly as dramatic as the number of cases, showing that we have an increase in real disease. And that is also indicated by the fact that we have increasing hospitalizations in Eastern Washington and a quite dramatic increase in hospitalizations in Western Washington. This is the graph that shows our effective reproductive number in both Eastern and Western Washington. This is the number we've been talking about throughout the pandemic, which is the number of cases that one individual the number of people that one case will pass the disease on to. And unfortunately, you can see now the effective reproductive rate in Eastern Washington is around 1.7. In Western Washington, it's around 1.8. And if you look across the graph, you will see that we are in the fastest, experiencing the fastest growth of COVID-19 since March. So the growth of disease now is about what it was in March when we saw our initial surge. What is very concerning to us is the number of COVID patients that are in our hospitals currently. The graph on the top shows hospital beds that are occupied with people with confirmed or suspected or confirmed COVID. And the bottom are ICU beds in the state that are occupied by patients with confirmed COVID. You can see that the hospital occupancy is increasing in both Eastern Washington and Western Washington. I am particularly concerned about how sharp the increase is in the number of beds occupied in Western Washington. Both regular hospital beds and the number of ICU beds that are occupied by COVID patients in Western Washington in particular. So our modelers also modeled out this week what our future may look like over the next few weeks if we continue the current trajectory of disease transmission that we are experiencing. So the gray part of this graph represents observed hospital admissions here in Washington. And starting at this reddish blue purple part, they modeled out our estimated our number of hospital admissions that we would be expected to see if our estimated November 1st transmission rate persists. So if we continue, if our outbreak continues to grow with an R effective number of 1.7 or 1.8, we, in a few weeks, will be having almost 150 people admitted to our hospitals every day. If the November 16th restrictions that the governor recently announced are as successful as they were back in March, we can reverse this trend and follow the course that is listed that is shown on the blue line. The next thing our modelers did is they looked at the chance that at least one person has COVID-19 in different group sizes on November 26th. So if we continue on the same transmission rate that we are on, you can see that if you convene with a group that is 200 people on November 26th, there will be about an 85% chance that at least one person in that group will have COVID. Likewise, if you convene with a group of people who are about 75 other people, there will be almost a 60% chance that someone in the group will have COVID. If you gather with 15 people for Thanksgiving dinner, there will be an 18% chance that one of the individuals will be infected with COVID. So I think what we're trying to show is that as transmission rates increase in our communities, the risk of everything we do, the risk of acquiring COVID-19 increases with every activity we do. So this is really the time that we all need to think about staying home as much as possible, because every activity that you do out in the community can carry some risk, particularly if it's indoors, and particularly if people are not physically distancing. So as John mentioned, I'm extremely concerned about the course we're on. I'm extremely concerned about how quickly our hospital capacity is, or our hospital occupancy is increasing with COVID-19 patients. And now is the time for everybody to change their behaviors. We can all do this. If we all do our part, we can flatten this curve.